Welcome back, it's Dr. Somji. This is going to be the most important video in our skincare channel, mainly because it's so confusing to know which product to use. There's hundreds of products that you see reviewed on social media, recommended, but how do you put it into your routine? So I'm going to go through a simple skincare routine that you can stick to and build on over the years to make sure that you get the skin that you've always wanted. So the first step is cleansing. You've got to cleanse twice daily. If you wear makeup, you may even want to double cleanse, but you need to be using the right cleanser. So if you have oily skin, a company like the Cetaphil actually shows exactly what you need. You've got the oily skin cleanser, which is essentially a foam cleanser. This is going to help minimize pores, reduce sebum production, but without stripping the skin. And if you look at some of the ingredients, it's got exactly the things that you need in a cleanser. It's water-based, it's got glycerin that's going to help with your skin barrier. Too many cleansers don't include things like glycerin. So look for glycerin, look for like coconut extract as well, which just help like build that skin barrier and not strip the skin. If you strip the skin with too aggressive of a cleanser, then you could lead into problems. So if you've got oily skin, foam cleanser is going to be the right thing. If you've got sensitive skin, you may want to go for like a creamy based cleanser that's not going to foam up too much. So it's got more of those essential things that will help calm down the skin like niacinamide, things that will also help and nourish that skin barrier like we've talked about. So some fatty acids that are essential for the skin. So if you've got sensitive skin, a cream based cleanser is going to be great. If you've got some very, very sensitive skin, you may even want to go for something a little bit outside of the box. So a lot of people say use oil-based cleansers. Personally, I don't like oil-based cleansers, mainly because I feel like it doesn't clean enough. And also they tend to include a lot of essential oils, so specific essential oils that can actually make your skin more sensitive. Of course, there are some essential oils that are good for the skin, for inflamed skin, such as rosehip oil. But there are others that they tend to include in these products that are not so good. So I'd stay away. And my top tip is to use something squalane based. So there's a squalane based cleanser from The Ordinary, which is fantastic because it's great for sensitive skin and it's also going to help build the skin barrier as well. For mature skin, you've got some great products like balm-based cleansers, which will just, again, hydrate a little bit more. You can use that squalane-based cleanser like I talked about, but balms sometimes feel a lot nicer, a lot more therapeutic. Some of them smell nice too. You've got to be careful with the amount of perfume in it. The Elemis balm cleanser, a lot of my patients use, but if you've got any form of sensitivity, you might want to stay away from that because they do have perfume and fragrance in there, which can sensitize the skin. So that's your cleansing routine. Make sure you do it twice daily, both AM and PM. If you've got makeup, then you might want to use a cream-based cleanser, second. You might want to use a foam-based cleanser first to get rid of the makeup, so that you're doing a little bit more of a deeper clean and then following it up with something that's just gonna not strip the skin too much. Second thing that we always have been told about is use a toner. But if you use a very good cleanser, so for example, if you're using something that's a little bit more of a higher price range like Zedo Skin Health or Ice Clinical Cleansing Complex, these cleansers tone at the same time. So the toner really, I think it's like kind of a marketing ploy really, to be honest, just to get people to buy one more product. I've never toned in my life because I've always used good quality cleansers. So it's worth investing in a good quality cleanser, a cleanser that will balance the pH so that when you put anything on afterwards, it gets absorbed nicely into the skin and you don't get any sensitivity. But what I would replace this step with is this, using controlled chemical exfoliants. These are split into alpha and beta hydroxy acids. There's some products that combine the both. So there's the Paula's Choice AHA BHA serum, which is fantastic. At a slightly more cheaper price point, you've got the Ordinary AHA BHA serum. You've got the Ordinary Salicylic Acid Mask. Got too many products here. That is fantastic for acne prone skin. So you want to choose the right acid for your skin type. So say if you've got sensitive skin, mandelic acid is fantastic. If you've got, let's say, a little bit of pigmentation, you're a lighter skin type, a little bit of acne, then glycolic is going to be really good for you. If you've got slightly darker skin type and you've got really kind of a lot of congestion, then salicylic acid is going to be a good option. If you've got more sensitive skin, then lactic acid is going to be a good option for you as well. So you want to choose the right acid for the right skin type, and you only really want to be doing that anywhere between 1 to 3 times a week, just to get rid of those dead skin cells, give a little bit of a chemical exfoliation so the skin is also smoother as well. So step 3 is serums. You want to be applying things that are lighter and more aqua based on the skin first, and then use things like thicker moisturizers, balms, and etc. afterwards. So let's stick to the serums. It's always good to use a product called hyaluronic acid. Hyaluronic acid attracts water into the skin. It helps our skin retain moisture, and it's also commonly mixed with certain vitamins. So you've got vitamin C, so you've got this Vichy vitamin C. It's not my favorite vitamin C in the market. My favorite vitamin C is SkinCeuticals. Vitamin C is at a very high price point, but it's the highest quality grade vitamin C. The problem that you have with vitamin C is that it degrades quickly. It's a fantastic antioxidant that's great for redness, great for pigmentation, great for even anti-aging benefits as well. But in certain formulation, it doesn't stay stable for long enough. So if there's one thing that you should invest a little bit of money in, it's definitely going to be on a higher quality vitamin C. Obviously without things like perfume, which will sensitize the skin, but something that's going to stay active for longer is going to be a good option. And my recommendations are just above. So the next thing that you want to be using, if you're using vitamin C in the day, which is like what I recommend, in the night time, you want to be using retinoids. We know them as retinols. That's the main famous buzzwords, but retinols belong to a family called the retinoid family. And you can get low strength ones and you can get high strength ones. Retinols sit probably in the middle, to be honest. And they're great because they're their only skincare ingredient that's proven to not only help acne, but also to promote collagen production as well, which is what we all need and what we all lose beyond the age of probably 18. So my tip for you for retinols is to use it after your cleanser, after you've dried the skin, and start low and go slow. So start with a lower concentration and then slowly up titrate. There's great up titration process with the Ordinary where you can go up slowly. I recommend the squalane based ones because they won't irritate the surface of the skin. But with retinols, you've got your lifetime to increase that concentration. So maybe when you're starting to use it once or twice within a week with an equal gap. If you're acne prone, you might want to use specific retinols for acne prone skin. One that I like to prescribe within clinic is adapalene, i.e. different gel, which is great. If you're using retinols for anti-aging benefit, then prescription grade things like tretinoin are fantastic too, but even over-the-counter retinols are really quite strong and effective as well. The next serum that you really should think about adding to your skincare is niacinamide. This is something that you can use post using something like a retinol to help with your skin barrier. So what we've done, we've cleansed the skin, we've used acids to help with exfoliation, we've used hyaluronic acid for the hydration, we've used vitamin C for pigmentation, pigmentation, sensitivity, redness. We've then used retinols to obviously calm down acne and help with anti-aging. But we need to make sure that the whole skincare package, i.e. the outer layers, are healthy. And that's where niacinamide is fantastic for nourishing the outer layers of the skin. It's also great for reducing pigmentation sensitivity. So it's great for your skin. So look for things with niacinamide in there. Sometimes you can get things combined. The Ordinary don't recommend mixing their pure vitamin C with the niacinamide, but more sophisticated formulations have them both combined. So it's kind of a myth to say that they cancel each other out, because clinical studies have shown that that's not the case. That's one thing that a lot of people get a bit confused at. The Ordinary don't recommend mixing certain things. It's always good to look at the conflicts list from the Ordinary, but that's more to do with pure vitamin C and mixing it. My recommendation is to save time, is to find serums that are a little bit more complex, that can incorporate a number of these things in there. The next thing is start playing around with your skincare with serums. So have even nighttime serums that maybe are retinol based, that maybe even have a few peptides in there. Vitamin C, include peptides. Peptides are the future of skincare. They're really effective and they're helpful in a number of different ways, and they improve your vitamin C's and they'll improve your retinol's ability to work. So, and that's the joy, you know, using different peptides. Oligopeptides is what you need to look for on the INCI list, on the ingredients list. And these are things that I have a lot of fun with. Number 4, moisturize always twice daily. We've talked about the skin barrier. It's really important. The skin barrier, if it's impaired, you could get sensitivity, you could get acne, you can get more pigmentation, you can get more damage to your skin in general. So if you don't have a healthy skin barrier, you're gonna lose that moisture and things are not gonna work very well with your skin. So after you've put these serums on, after you've cleansed, after you've used your acids, then you want to be putting on a slightly thicker layer of moisturizing. Now it's great because you've got things like the Cetaphil moisturizing lotion, and this is great because it helps with dryness even within your moisture barrier within 1 week. It's niacinamide based, it's got panthenol and vitamin E. These are things that are great for the skin barrier to make sure that your skin is nourished. Ceramides are really important as well. CeraVe is a great brand for ceramides. It contains the 3 essential ceramides for function of that skin barrier, so you don't lose moisture and your skin is a lot more calmer as well. If you've got oily skin, you can use gel-based moisturizers, which are great. If you've got normal skin, lotions like the one I just showed, the moisturizing lotion from Cetaphil is absolutely fine. If you've got drier skin, you might want to use a more cream-based moisturizers. And if you've got very inflamed skin, you might want to use specific balms as well. So these are the key steps. The final step, which is really important, is to further protect the skin, not only from pollutants, but also from the main enemy of skin, which is UV exposure. So wearing SPF is extremely important, at least wearing it about an hour before sun exposure. So going out anywhere, even if you're sitting in the house on a day, on your phone, on your laptop, these are types of damage to your skin that can not only increase the amount of pigmentation you get premature aging, increased sensitivity, and even cancer risk. So applying SPF minimum of 30 SPF daily, and also applying in sunlight hours every 2 hours is essentially important. It's quite difficult to do. I'd start with a mineral sunscreen. Dermalogical's got some great mineral sunscreens, and then booster sunscreens afterwards. So you've got this Solar Defense Boost SPF, which you can apply in the daytime. You can keep it in your pocket if you're in sunlight hours. It's extremely important. You don't want to be doing all of those 4 steps and then missing the main one, which is your protection. So don't start invading if you haven't got your defense sorted out. So here's a bonus feature. Look, are you gonna use skin tools? Well, I think the best skin tool is these 2 bad boys, your hands. So you can use all these fancy cleansers, little skin gadgets and things like that, but with your hands, you can improve blood flow by doing facial exercises, which you may have seen me doing. You can also cleanse the skin thoroughly rather than using some of these Lumi Spa like brushes that build up bacteria. I can fully sterilize my hands, so you can clean your hands before you do your makeup. That's fantastic, so you won't get any bacteria. And it's also a gentle exfoliant, and a physical exfoliant that's not going to damage your skin. So these were given to you, use them. The other thing which I'm a big advocate of myself, obviously having a beard, is to use face oils. So if you want to brighten the skin, things like olive oil based products are fantastic. JLo will tell you that it does absolutely everything. If you've got increased bacteria, marula oil from the drunk elephant and from the ordinary are fantastic. And if you've got inflamed skin, rosehip oil is also fantastic to use as well. So if you feel like your skin lacks a little bit of moisture, or you want to add a little bit of luxury, you can add it as a bonus feature after step 4. That's it. My final take-home message is to make sure that you live well, eat your greens, exercise, drink plenty of water. That's going to be your skincare routine. Those are your top 5 steps for a great skincare routine that you can build on over the years. If you look at this video and then you look at all of my other videos looking at things, everything will sit in nicely. Those are the key rules. Start applying products that are thinnest first, up to the thickest, then you'll never go wrong. If you have any questions, you can always double check by just leaving a comment below. We always try and respond to every single comment that you guys give. Don't forget to subscribe to the channel because you will have great product recommendations as well as anything about skin. We talk about it. And also click that bell because when there's new videos, you'll be the first to know.